Thank you. You now have Hannah Anderson.
Hi, good morning, everyone. It is a beautiful day to be talking about Patients First Healthcare. Although I'm telling you, if I'm here much longer, I'm going to start turning the color of this dress because it's a solid Scandinavian and my skin can't handle it. But it's such a pleasure to be here with so many Patients First advocates, Patients First colleagues, and policymakers, because we all get to be here today to celebrate the advances that have been made in Patients First Healthcare. And you know what? No president who has fought more for patients than President Trump. You know, patients didn't know how much they were paying when they went to the doctor, and President Trump changed that. Patients didn't know what options they had at the pharmacy counter or how much they were going to pay when they got to the pharmacy counter, and President Trump changed that too. Patients were getting ripped off by freeloaders here and abroad, and President Trump changed that. And under the great healthcare plan, which we all get to be here to talk about today, patients can achieve even more. We can finally get full transparency into costs from both our health providers and our health plan. We can get full accountability from the middlemen, and we can get lower healthcare costs. And most importantly, we can get our healthcare dollars back. And so Patients First policymakers, again, like the ones here today, understand that taking back your health isn't just about healthy eating or healthy living. It's also about taking back your health dollar. Because how are you supposed to make good decisions for your health if you don't have control of your healthcare dollar? So when patients can control their health dollar, they can finally take back their health and spend that dollar on what helps them be healthy. And you know, families are suffering. So for a family in DC with 2 children, a plan can still mean thousands of dollars in premiums and a $10,000 deductible before coverage really helps, which is exactly why this family will skip care. They don't have the options they need. They don't have the flexibility with their health dollar, and comprehensive coverage ends up being a really unfulfilled promise. And this is the story of so many in the United States. The Great Healthcare Plan offers a way to make care more affordable and accessible by giving people their money back. And so today at the America First Policy Institute, where I lead our healthcare policy, we released a paper, 5 papers, showing people and policymakers what we can do to actually give people more flexibility, more control, and their prices to really achieve the president's vision for a great healthcare plan. Thank you so much. Appreciate it.